Good afternoon, everyone. It's 12:32, so we'll get started. So thank you for joining the webinar. My name is Mir M. Ali, and I'm the Chief of Advanced Data Analytics over in the Division of Behavioral and Social Research at the NIA. On behalf of myself and my colleague Nada Radoja, Marcel Soliv from the Division of Neuroscience, Joe Cherzanelli, Becky Krapanovich in the Division of Behavioral and Social Research, Ramesh Vimuri from the Scientific Review Branch, and Ryan Blakeney from the Supports Branch. I would like to welcome you all to the webinar. And before we get started, just a few housekeeping items. And I guess even before that, I would request everyone to be off camera just so that, we could save some Wi-Fi connectivity and avoid these kinds of issues. But that during the Q&A, we'll all come back on camera and I could take questions then. A few housekeeping items for us to go through. This webinar, as you know, is being recorded and it will be shared publicly on our website. The intention behind the presentation and this webinar is to provide a broad overview of the RFA. For additional questions on the specificity, we request everyone to please refer to the RFA. Now, for questions, you can use the chat feature to put in the questions. And also during the Q&A part of the presentation, the intention here is to answer all the questions. If there are questions we're unable to get to, and if there are questions that requires additional time and information, we will put answers on our FAQ website, and we'll share that when that's available. And the final item is that, us over at NIA, we will not provide opinions on specific terminologies or recommendations on specific features of the application. Our contact information is here for any scientific or programmatic inquiries. Feel free to email me. For budget and administration-related inquiries, please reach out to Ryan. For peer review-related inquiries, please reach out to Ramesh. So this is the outline for our presentation today. We'll go over the purpose of the RFA. We'll touch on the research objectives. We'll talk about some structure and required activities. We'll spend some time talking about the non-responsiveness criteria, and then we'll finally discuss milestones, and then we'll open it up for Q&A. Okay, so the purpose. So the purpose of the RFA is to invite applications that aim to develop common data elements for NIA-funded studies on ADRD using real-world data and claims data from CMS. The CDEs will foster data harmonization and interoperability across and among NIA studies. By reducing efforts required for data harmonization and improving interoperability, the aim here is to enable a wide array of researchers to utilize the CDEs and the files generated from this project more efficiently and produce real-world evidence in a timely manner. So with this in mind, the project has 4 objectives. 1, identify research questions and use cases. 2, develop CDEs encompassing the 7 domains identified by the NIA Technical Expert Panel that took place in February, and we'll talk more about that in a bit. Create longitudinal files and CDEs using Centers for Medicare and Medicaid Chronic Conditions warehouse claims and other real-world data. And then finally, to evaluate and refine the developed CDEs so that, this exercise is not something static, but something that is more dynamic and iterative and improves over time. This is U24 cooperative agreement. So there will be substantial NIA staff involvement in the project, but we encourage everyone to please refer to section 6.2 of the RFA for additional information. Roles and responsibilities are all laid out over there. Now, this is the budget slide. So as you can see, the total cost per year for the project is $4 million, but the budget for direct cost cannot exceed $3.75 million. And then starting in year 2, applicants must budget for a minimum of 6 one-year awards per year, totaling $750,000 in direct cost per year. And we'll revisit this requirement again in the presentation. And so I have received several questions about this yesterday, and I'll try to sort of weave in some of the answers as I sort of go along. But again, you know, you're encouraged to ask these sort of questions again in the Q&A. And again, if we are unable to answer all of them, we'll post the answers in the FAQ page. So now we'll cover the 4 sort of research objectives in a bit more detail. So the first objective is identifying research questions and use cases. So applicants must collaborate with various stakeholders, such as NIA-funded studies, healthcare professionals, people living with dementia, caregivers, policymakers, real-world data vendors, and researchers to identify research questions and use cases that can be addressed by data harmonization and CDEs. Now, the use cases must align with the ADRD research milestones, particularly those related to data infrastructure and data sharing and interoperability, among others that are listed in the RFA. And then evaluate the feasibility, availability of data, and acceptabilities of these within the research community for each of these use cases. Now, the second objective is developing CDEs encompassing the research domains. Now, in February 2023, NIA convened a technical expert panel focused on CDE development for harmonizing real-world data from healthcare claims and EHR for ADRD research. Now, a link to the TEP is included in the RFA, and I want to encourage everyone to read that. Now, the TEP underscores the significance of capturing data across 7 specific domains. 1, patient and caregiver demographic information. Number 2, disease characterization, including ADRD diagnosis. Number 3, health assessments such as activities of daily living, instrumental activities of daily living, cognitive function, etc. Number 4, biomarkers, genetics, and genomics relevant to ADRD. Number 5, treatment for all conditions. 6, patient and caregiver health outcomes, and 7, non-health data, such as social determinants of health. So the applications must utilize insights from the TEP meeting to create the CDEs encompassing these 7 domains, and then harmonize data from NIA-funded studies and create these CDEs. Now, the third objective is the creating the CDEs and the applicable longitudinal files. So applicants must develop CDEs that consider the evolving coding schema of the NIA-funded studies linked with CMS data over time to ensure accuracy and relevance. Now, this happens by utilizing CMS chronic condition warehouse files and the NIA data linkage program to access CMS claims data to establish ADRD research longitudinal files. Now, related to this, the applications must plan to use artificial intelligence, machine learning, and natural language processing for the creation of the CDEs and the longitudinal files of any of these NIA-funded studies linked with real-world data. Now, we'll touch upon the use of AI, ML, and NLP again as we move along in the presentation. Now, the fourth element is in the research objective is to evaluate and refine these developed CDEs. So applicants must rigorously test the developed CDEs and iteratively refine them based on findings and updates in the coding scheme. Now, as mentioned earlier on in the presentation, we don't want this project to be a static exercise, but rather a dynamic process where improvements and lesson learned can be incorporated in the framework. Now, this will also involve then validating the data generated with the applications of AI, ML, and NLP manually as needed. Now, the applications must also ensure compatibility with various NIA data initiatives and infrastructure, such as the NIA linkage program, and we will facilitate collaboration with these other infrastructures and initiatives as needed. Now we'll talk about the structure and the required activities of the RFA. Now, applicants must propose an organizational governance structure to support proposed research, administration, innovation, and dissemination activities. Administrative activities must include, but are not limited to, the following: hosting virtual meetings and learning labs to address research and administrative matters, fostering interactions and engagement between NIA-funded data, real-world data users, stakeholders, and NIA staff, responding to queries from NIA staff and information requests generated by the greater NIH community, the scientific community, and the public, planning and administering project aims in collaboration with NIH staff in accordance with the terms and conditions of the cooperative agreement, organizing, maintaining, and engaging a panel of subject matter experts to provide insights to inform project activities. Innovation. So innovation must encompass active collaborations with researchers and stakeholders to develop longitudinal files of NIA-funded studies linked with real-world data, and then developing guidance for the data. So related to this, and as mentioned before, applicants must use AI, ML, and NLP to create longitudinal data sets of NIA-funded studies linked with real-world data. Thus, this also includes the validation of the data generated with the applications of AI, ML, and NLP manually as needed. Now, another aspect of the innovation is to encourage data harmonization and adoption of developed CDEs in AD/ADRD research. So for that, applicant has to support at a minimum of 6 new research studies per year, beginning in year 2. Now, the research studies are expected to be selected through a nationwide open solicitation and awarded beginning in year 2. And at least 80% of these research studies must be awarded to researchers who are not affiliated with the U24 Institute, because the intent is to encourage uptake and contributions of harmonized data and CDE. So research studies are required to use data produced from this project or generate data that can contribute to this project. Dissemination. So applicants must describe the innovative approaches to ensure wide dissemination of all products and resources developed by the project to the research community, policymakers, and other relevant stakeholders. As such, dissemination activities must include, but not limited to, the following: creation of a comprehensive website that includes all products supported by the project, such as guidance, documentation, data harmonization documents, harmonized data, CDEs, workshop summaries, codes to create longitudinal files, evaluation results, etc. The website must include a CDE database that categorizes CDEs by the domains and includes key information to support research use, example, data source and coding scheme. The website must also include codes that researchers can use to create the longitudinal CMS files, either from CCW files or from the NIH linkage program platform. The other dissemination activities include hosting of an annual national CDE user group meeting. So applicants must describe the approaches for planning and hosting annual meetings at the NIH campus in coordination with NIH program staff. The purpose of the annual meeting will be to share updates and scientific advances, discuss and plan collaborative activities with researchers and stakeholders, host expert sessions on CDEs, and present results from the evaluation, among other things. Applicants must also propose plans for other types of dissemination activities, example, research briefs, blogs, or other means to highlight and disseminate activities of the program through the website and other platforms to reach the research community, policymakers, and other stakeholders. So we will cover the non-responsiveness criteria now. So applications that do not include the following 10 items will be considered non-responsive and will be withdrawn prior to the application. So one is plan to use EHR and CMS claims data, so either CCW data or data from NIH's linkage platform to harmonize and develop CDEs. Plans that uses AI, ML, and NLP and data validation. So that is any application of generative AI must include validation. Provide preliminary data highlighting applications of AI, ML, and NLP to generate harmonized variables or CDEs and validation techniques. Plans to use all types of CMS files, example part A, B, C, and D, and NIA-funded studies linked with CMS data. Plan to develop CDEs in the 7 domains identified in the NIA tab to achieve the objectives of this RFA. And moving on, sharing of resources, that is codes and longitudinal files as applicable. Plan to collaborate with other NIA-funded awards in similar domains. Plan to allocate $750,000 in direct cost per year for annual national competition for up to 6 external awards beginning in year 2 for research studies, research administration, innovation, and dissemination activities. And number 10, a measurable set of milestones and timelines for accomplishing the administration, innovation, and dissemination activities. We will now move on to the milestone portion. So the application must propose plans to meet project milestones. Milestones must be specific, quantifiable, and scientifically justified, and the application must also include a timeline for milestone completion. Applications may suggest other milestones for consideration by NIA, but the application must propose plans to meet the following 9 project milestones. 1, establishment of a public-facing website with an overview of the project within 2 months of the award. Number 2, submission of the CMS CCW data request and or linkage data request within 2 months of the award. Partnership with NIA-funded studies within the first 3 months in order to harmonize data and create longitudinal files. Hosting of an annual national data harmonization and CDE user group meeting beginning in year 1. Development of CDEs encompassing the 7 domains ready for research studies to use by the end of year 1. Number 6, development of harmonized longitudinal data sets or codes of NIA-funded studies. Now, this will happen by the end of year 1, and then updates and iteration will happen in all of the other years of the project. Number 7, posting of data harmonization code, CDE, domains and codes, as well as other resources, example, longitudinal file creation codes on the public-facing website by the end of year 1. This can also include securely posting longitudinal files of NIA-funded studies. Number 8, award at a minimum of 6 research studies each year, beginning in year 2 through a national competition. And again, with at least 80% of the research studies being awarded to researchers who are not affiliated with the U24 Institute. Number 9, update harmonized data from NIA-funded studies, CDEs, other data when applicable, codes, and relevant documentation beginning in year 2. And I think that's what I had for the presentation. Now I'm happy to take questions. And once again, our contact information is posted.
So there's a question about, could we have an example of NIA-funded studies? We rather not specify or name an NIA-funded study, because then we may show favoritism towards one study, longitudinal study, or another study, right? So at this point, we will not name any, but you can visit the website and you can see it and review it.
Yep, thanks, Partha, for taking that.
Partha, they can also go to NIH Reporter.
Right, Ramesh. NIH Reporter is an excellent source for all NIA-funded studies. Thank you.
Okay, so there's a question on, for CMS, are we expected to propose new linkages or use existing DOAs? Again, as stated as in the purpose of the RFA, the purpose here is to create CDEs using our real world data. We would encourage you to take a look again at the non-responsiveness criteria. There is another question, use cases will be conducted by U24 teams or will be conducted by the 6 awards per year from year 2. So the use cases should be conducted by the U42 teams, and I'll have Partha, Marcel, and Nada weigh in if there's anything that they want to add. But the 6 awards starting from year 2, the idea then there would be for those researchers to use the CDEs and the longitudinal files created. So hope that answered the question. Partha, others, do you want to read? Partha, you have your hands up.
Yeah, sorry. So starting year 2, you would have research teams apply, right? And that's why the awards are going out. You will see there is a benchmark. 80% of the awards needs to be outside of your stated institution, right? So you will administer it as the institution if you're if you're managing the U24, but 80% of the awards are going outside of the institution.
Thanks.
Does that help, Dr. Sheng? And my colleagues can weigh in on and add any details if I missed anything.
Thank you.
I have a question on the budget funds available in each year. Early in the presentation, you had mentioned that each of the 5 years has a $4 million total cost cap. In reading the RFA, my reading of it was that year 1 had a $4 million total cost cap, but that each of the subsequent years only had a 3.75 direct cost cap, and not a total cost cap. Is that accurate, or is there a $4 million total cost cap in each of the 5 years?
So there's a $4 million cap on each of the total cost in each of the 5 years, and then following that, direct costs may not exceed 3.75 per year.
Okay, thank you. As a follow-on question to that, I also noticed that there was in the RFA, salary escalations year over year are prohibited, but we are able to escalate other direct costs year over year. Is that accurate?
So and I'll post a detailed answer about this in the FAQ, but cost escalations are not allowed for all types of funds.
Hello, I can chime in on that as well, Brian. This is Ron Blakeney from the Grants Management Office. As stated, escalation costs are not allowable, but you are allowed justifiable increases. So in your budget justification, if you have the need for more money in a future year than you did in a past year, you can include that increase, but you have to justify that increase in your budget justification so that we can review it and make sure that it's not a standard cost of living increase that you're asking for.
Okay, thank you very much.
No problem.
And thank you, Ryan. There was a question on, can you weigh in on the extent to which NI expects the selected use cases to align from those of the technical expert panel? So yes, the used cases must align with the 7 domains identified in the TEP. Any questions? When it's silent, I get nervous. So either the webinar answered every single thing, or folks were not able to hear me and don't know what to ask. Is someone talking?
It looks like there's one more in the chat.
Let's see. So the last one that I see is on the technical expert panel. Here's another one. All right. The CDEs developed as part of this effort needed to be endorsed by the NIH to be published in the NIH CDE repository. So great question. So the this RFA activities is independent of the NIH CDE repository. So that's a separate process, and we're not planning on touching that with this RFA. Other questions? Okay, so we have another question on the chat. In addition to the SF-424, key person profiles, are there specific degree requirements? So I don't think we can go through the SF-424 specifics, but the required experiences of the project directors and principal investigators are listed, but there are no sort of specific degree requirements. I don't know if others from the team want to weigh in on that. There's another question. Is the awardee required to solicit and select subrecipients, or are the subrecipients chosen by another NIH RFA? So I guess Partha has his hands raised. Partha, do you want to take it?
Yeah, and again, I will double team with Ryan to come in on this. As far as I know, if you are submitting an application, you're putting in all the subcontracts within that application, right? And you're responsible as a prime for that, right? And that's your job. We will not do that for you. Ryan, please correct me if I'm wrong on that, and advise properly. Thank you.
No, you're 100% correct. We don't get involved with the prime subawardee relationship. That's totally up to you. You're free to negotiate with whatever eligible institutions you want to.
So several more came in the chat, so let me take them as they come. Okay, all right. Well, what level of involvement will NIA have in the selection of subject matter experts and provision of data from currently funded NIA studies to facilitate CD generation and harmonization efforts? So the subject matter experts and expertise that's in the domain of the applicants, we will not have much involvement, but in the RFA it's stated around subject matter, the expert advisory panel, which we at NIA will select. I don't know if Partha has anything to add to that.
Just to reiterate the point, you as an applicant will select subject matter experts. We specified review requirements, right, which peer reviewers will review. So you have to select the experts to put the application together and then submit the application. So I hope that answers your question.
Okay, all right, there's another question. Is hardware development besides data analysis by AI or other means is allowed in this project? So as we specified in the RFA, and as you could see from the non-responsiveness criteria, the primary aim here is the development of CDEs using real world data. And for other specificity, I would encourage you to look at the RFA. Okay, another question. If working with NIA data that are linked to CMS, are we expected to conduct all activities, AI, ML, NLP, within the NIA linkage enclave? So you're definitely welcome to use the NIA linkage enclave, but I do want to emphasize that one of the requirements is to use CMS CCW data, because with the linkage, you're not going to capture 100% of the CMS claims. With the CCW, you will have that. So Partha has his hands up, so I'll let him add some more context to it.
So if you already have CCW data, like 100% file, 5% file, or 20% file, right, then you have that in-house. For example, you can do whatever within your institution allows, right, within the security parameters. If you're using VRDC, you're limited to whatever tools CMS VRDC allows. If you use our enclave, that is the linkage enclave, there are certain tools that are available. For example, I'll throw in Python will be available, R will be available, but I'm not sure what else is needed or will be required, but we can explore those avenues. But I cannot talk about it because it's way in the future and we have not seen any of the applications as of now. It's going to be on a need basis. But again, at the end of the day, in summary, if you have shipped CMS data, you're conducting that work in-house, so you need to have tools in-house. if you're in VRDC, you have to follow CMS rules, and whatever they allow, that will be allowed. Within the linkage, we allow certain tools, and you'll be limited to those tools.
Perfect. And then I think there was another question on the CMS data and the linkage. I hope Partha and I were able to sort of provide context, but if not, you know, we can clarify some of it. Okay, all right. I think the next one was more of a comment than a question, but I want to see if Ryan had anything to add to it.
Yeah, you can see the comment over there. It's a pretty large comment, so I won't read the entire thing. But the bottom sentence says this reads as proposers cannot justify any salary increases, and that is only for supplies, equipment, etc. That's pretty much true. Your initial salary is going to be set based off of your effort. So if someone is giving, 6 calendar months of effort for $50,000, if their effort increases to 12, then their salary can go up to $100,000, but it can't go up to $150,000 because that wouldn't be a justified increase. So yeah, there really is no justification for a salary increase outside of your effort increasing. If you get a raise or something like that, it can be covered, but we're not going to give you additional funds for that. So you could rebudget some costs for that if you see fit and it's allowable, but we're not going to issue additional funding for that, in a future year.
Thank you so much, Ryan. Other questions? Partha, you have your hand raised, so wasn't sure if it's from the previous one.
Yeah, there is a question, and maybe again, it's about asking for specifics. It's how to connect U24 with other existing NIA-funded studies. Most NIA funders don't link to real-world data or CMS data yet. Do you have a list of NIA-funded studies that should be linked with U24 when it's funded? A clarification here. One, we are not asking you to link to NIA-funded studies, right? This RFA is about creation of common data elements across those 7 domains that the TEP advised us on, right? Number 2, we have colleagues across NIA on this call, across divisions, right? So I don't think it'll be proper for us to name the studies, but we will urge you, as Dr. Vimuri said right in the beginning, right, to look at the NIH reporter to find studies. That's one way. But after the grant is awarded or the cooperative agreement is awarded specifically, we will have a project scientist who will play a greater role in facilitating exchanges. But again, I reiterate, we have not requested linkages as part of this RFA. Marcel, do you want to weigh in on this one as well?
Well, there are definitely some websites of NIA that discuss large studies, and some of them do have linkages. So I think, we're not listing them on this website, on this call today, but I think they're, findable. And and if you don't get them all in your application and you want to change it, there's some wiggle room during the execution of this award. Finally, I just wanted to point out as a kind of a general comment that, it's critical to read this RFA several times and really pay close attention to the sections 4 and 5 about, what to put into the application. There's a lot of details there that are specific for this RFA, and we haven't had a time to go through them every single one. but they're in great detail. And then I think also Section 5 is on what the reviewers will be looking for. They correspond very closely. So if it was said in the RFA to include something, the reviewers are told to look for that. And so it will be noted in the review. And so, we've only hit the highlights really on this call. So you really need to look in more detail. And we can't get down into the level of that detail even on this call because it's so excruciating. But we've done our best to kind of give you the high level overview. Thanks.
Okay, other questions? And as Partha said, this is being recorded and will be shared. So no apologies needed for joining late. All right, so it's 1:14, so we're getting to the 15-minute mark. So if there's not any other questions, then we'll probably conclude. See, there's a question. Are non-pharmaceutical intervention considered as a number 5 treatment for all conditions? Again, we encourage you, highly encourage you to read the TEP. And I think all the details around what are the treatments are sort of provided there. Martha, you have your hand raised.
Yeah, so again, maybe I'll tag team on this with Marcel here and Mir. If you look at claims data, there are various types of treatments that are captured, right? If you're asking, are you going to capture beyond pharmaceutical treatment in the CDEs from the claims data? I think, yes, that is broad enough. We have not gotten into the specificity of saying pharmacological versus non-pharmacological. We have not stated that explicitly. But again, I'll ask Marcel to weigh in because he's our medical officer and he knows claims data better than most because he also spent time at CMS. Marcel?
Right. I think broadly speaking, the answer is yes. But some things are easier to consider than others. So I think, yes, non-pharmacologic treatments, there's lots of those. So.
Excellent. All right, I think we're past the 15-minute mark. Alrighty, just want to thank you all again for joining. And we'll, like I said at the beginning, we'll post the recording on our website as soon as possible. And we'll also have a FAQ page where we'll list the questions that we have received along with some answers. Right. Thank you so much for joining. Have a wonderful rest of the day. Bye.